Thank you very much. Thank you for being with you here. I'm glad that I'm able to host this event because this is a topic which is, I think, very important. As was already said, immunization, vaccination is the most cost-effective and most efficient way of providing health treatment, which saved the biggest number of lives. If you look at the entire history, I think, and the biggest groundbreaking thing in healthcare, which enabled us to eradicate some of the diseases and to increase life expectancy dramatically, not just in Europe but the entire world. Definitely, this is caused by immunization. The problem with immunization, political problem, is that people take it for granted. People think now that all of these diseases do not exist anymore. They will not come back, especially in Europe. If they exist, that it's only a problem in Africa or parts of Asia, etc., which does not have to be the case. So if we neglect immunization, if we neglect public health programs, preventive public health programs like this, then we can have a problem. Of course, and we saw that also in my country, in some cases, in some parts of my country where we have problems with vaccine hesitancy in general, that certain diseases which were not common have now to some extent come back. So this is something that definitely is still relevant. It's still important public health issue. It needs to be put on the agenda. The most important thing that was mentioned before is political will, because when there is a political will, we can always find a legal way to regulate something and to find solutions to something on European level. It is true that healthcare generally is a national competence, but public health threats are a shared competence. That's true. Funding is, again, primarily national competence, but on the other hand, also you can provide help to the member states, can provide financial assistance in terms of also organization, sharing best practices, providing guidelines, etc., etc. So anyway, so what I want to say when we speak about health policy on European level, even though it is primarily a national competence, if there is a common problem which member states cannot solve by themselves, then EU can and should help, and if there is a political will, the legal justification can always be found. Political will was there definitely during COVID, and COVID really, in a sense, helped put healthcare in general higher on the agenda here in Brussels. So before COVID and Europe's beating cancer plan, healthcare was completely marginal topic in European institutions, to be perfectly honest. But with COVID, all of these things and all of those problems, like problems of vaccine hesitancy, lack of trust in the public health authorities, question of whether we trust science or not, question of misinformation, disinformation, fake news, etc. All of this came to the fore. So all of these things which were not discussed that much before. So of course, with let's say the end of the pandemic, at least of COVID, obviously this topic is not that much talked about anymore, and I think this is not good because as I said, there are many things, many diseases which can come back, which there are many public health dangers in terms of public potential outbreaks of new diseases. So definitely vaccination has to be put and stay high on the agenda. My topic for today, that I was told that is expected for me to say something about, is European health data space. So I think one thing that came also to the forefront during the COVID was the question of lack of reliable data, especially comparable data between different member states, that you can actually compare the causes, you can compare problems that exist, and you can compare the results. For instance, we saw during the pandemic that there was a lot of questions how we compare data of the number of deaths from COVID, with COVID, etc., etc. So I think sharing data, having interoperable ways of exchanging data between member states is crucial if we want to make public health policy decisions. So, and European health data space can really provide a breakthrough there, and I think that's the most important health legislation that we adopted definitely in the previous term here in the Parliament, but I think even broader, because that's one piece of health legislation which is really producing and creating something completely new that we didn't have before. So just shortly on health data space, so it consists of two dimensions: primary use of data and secondary use of data. With primary use of data, the idea is that our health data will be digitalized in much broader than it is now in some member states, which already have that. this data will be made in one common European format, and whichever health professional anywhere in the EU you have to go to. For instance, you are on a business trip, you are studying as a student on a student exchange through Erasmus or something else. So you are from Croatia, you come to Belgium, and then you can go to a Belgian doctor, and they will be able to see all of your health data, see whether you are suffering from some kind of disease, whether you are allergic to something, maybe some vaccines, etc., and provide you with health treatment much faster, much more effective, without the need to duplicate different examinations, tests, etc., etc. So that's for the individuals. But for us, more important is the so-called secondary use of data. So that's the reuse of the health data that we have in the system, but not for use by healthcare professionals, but for some broader considerations, like making policy decisions, like research, innovation, creating new medicines, new vaccines, etc., etc. So the whole idea is that the health data sets that we have on patient populations, patient groups suffering from different diseases, different medical conditions from different member states will have to be categorized. So by hospitals, university institutes, research institutes, etc. This data will be cataloged. These catalogs will be made public. And if you want to do a research on something, for instance, from France, and you see that there is a data set which can be useful in Italy, in Rome, then you will make a request to the public health data access body in Italy, and if you fulfill the requirements, and the main requirement that what you're asking the data for is something in public interest, public health policy, then you will be able to access this data. What is important, obviously, with health data space is that we have very strong provisions how to prevent misuse of data. As I said, we have clearly defined purposes for which data can be used. So public interest purposes, essentially. So as I said, policy decision, research, innovation, things like that. That data, nobody will be able to take away your data, download your data, take it with you. So it will be accessed in a secured environment under control. Somebody who wants to do research will be able to do research in that environment on that data, and that's it. And of course, all of this data that is used for secondary purposes will be anonymized or pseudonymized, and we have clear provisions. And if this is violated, those who violate it will be penalized. This access to data may not be used to identify individual patients whose data it is. So we have very strong provisions on control, on protection, and finally we also give the patients right to choose. So if some patients do not want their data to be used, they don't want their data to be exchanged, to be used for secondary purpose, etc., they will be able to make such a decision with a so-called opt-out. So in this way, we are giving the patients the right to decide if for any reason they don't want their data to be part of this system. But on the other hand, obviously, we also have an opt-out system, so that instead of an opt-in or consent-based system, so that we get data which is useful, which is representative, because studies show us that with an opt-out, you get data which is much more representative than with an opt-in or a consent-based system. So that means essentially that if you want your data not to be part of the system, you have to state it explicitly that you want out, let's say. So I think by doing this, we are striking the right balance between, on one side, the need to use data, which is useful and representative, and on the other side, the need to give patients the right to choose. So I think this can really be groundbreaking. I think this will really give us possibilities to make policy decisions in a much better way on the level of Europe, but on the level of different member states, to compare vaccination policies in different member states. And I think when public health authorities make decisions on what kind of vaccination campaigns they need, which should be the groups that they target, in which way, etc., that this data that we will get from European health data space will be of extreme importance. So to sum up, I think it's important to maintain vaccination high on the agenda. That's probably the most, or one of the most effective public health policies that are out there. We have to get enough data that we can make informed decisions. But of course, it's also important and it's crucial to inform the citizens, to inform to fight against the hesitancy, which is one of the biggest problems now, to strengthen the trust in science, and to make it possible that vaccination still is maintained as the most effective public health policy. The problem in some member states is the lack of trust in institutions, and I think the data and studies show us that if you look at vaccine hesitancy and differences across different member states, that trust in the institutions is one of the big problems. So I think this is also something that we have to engage on, that we have to work on, to strengthen the trust in science, trust in public health institutions, in policymakers as well. So this is why I think it's important that this whole system of vaccination is strongly controlled, that we have all of the safeguards to make sure that nothing is misused, that nothing is utilized in a wrong way. And I think if we build such a system, if we are able to strengthen the trust of people in the system and the institutions, then our policies can be successful. So thank you again for reaching out, for initiating this. I'm glad that we are able to keep this momentum on this important topic here in the Parliament. And of course, I look forward to the discussion. Thanks.